Hello, my name is Maria Daniela, and I will be talking to you all about depression amongst older adults. There is a popular belief that most older adults are depressed, but in reality, the rates of severe depression actually decline from young adults to older adults, according to the National Institute of Mental Health. Nevertheless, it is still an issue and a very common mood disorder. Specifically, I will talk to you about two evidence based treatments in psychotherapy that have proven to be effective in treating this mood disorder. And two approaches that seem to work the best is behavior therapy and cognitive behavior therapy. They sound similar, but behavior therapy focuses on attempts to alter current behaviors without always knowing why those behaviors are there, without necessarily addressing any underlying causes. CBT actually attempts to alter the way that you think. According to Dr. Peter Lewinson, the idea of behavior therapy is that depressed people receive too few rewards from their environment. Because of this, the goal of behavior therapy is to get them to increase the chances of good things happening to them. In order to get activity levels up and negative thoughts down, behavior therapists actually assign tasks or maybe even force clients to practice these principles that they're learning during their sessions. So they may force a client to go out and meet new people, to join a club. And family members are actually instructed to ignore any negative statements made by the depressed individual in order to really focus on rewarding positive self-statements with attention, praise, even money, anything that makes the individual feel good. CBT is based on the idea that depression results from negative beliefs about the self. In CBT, the person is taught to recognize these thoughts, to be aware of them, and to realize that they're so ingrained that other perspectives just aren't seen. Consequently, the person learns how to evaluate themselves, the world, the future in a more realistic manner. Patients may be assigned homework that involve reattributing the causes of an event, maybe examining the evidence before jumping to a conclusion, maybe listing pros and cons. And the people that believe that they have been failures all their lives or that they're unlovable are taught to use this newfound knowledge to achieve more realistic appraisals of themselves, which is great. Cognitive behavior therapy is especially effective for older adults because medications are not always tolerated by aging populations because of their reactions with medications that they might be taking, or also overall changes in metabolism due to aging might really affect the way that the medication is digested. And the important point in differentiating mental health from psychopathology is that every behavior must be interpreted in context. We must all consider what else is happening. How does that behavior fit the situation, in addition to other factors like aging and other personal circumstances?